Health Beat with Dr. Benita Zahn.
Welcome. If an elderly relative or family member with a complex medical case has been hospitalized, you know that getting them the appropriate aftercare can be a daunting challenge. To that end, the Healthcare Association of New York State penned a white paper on the issue titled "The Complex Case Discharge Delay Problems." Victoria Aufiero, Senior Director of Insurance, Managed Care and Behavioral Health from HANYS, is my guest. Vic, thanks so much for being with us.
Thank you so much for having me this morning.
So this is an issue, and the first up is, and I hear from a lot of people, they'll call in, they say they want to send mom or dad home, but there's nobody there. I can't be with them. How can they possibly do this? So let's take it from that perspective. What kind of rights do we have? What do you do? What are you finding?
So what we have been hearing, from our hospital members is that really our system of care is designed for those patients who have a clear path to discharge, for those who don't have complex care needs. In situations where there are those, complicated discharge needs, aftercare, comorbid conditions, it can be really difficult to find a safe discharge, and that is always the goal. And a hospital cannot discharge a patient until there is a safe plan in place. And so it involves...
Let me jump in, Vic. Hospitals do discharge even without a safe. It's their definition of safe and the family's definition of safe are not always the same.
There may be differences, but the goal is always to have what has been identified and works for the patient. And, it may not be a perfect solution, but we are looking for the best possible solution for patients, knowing that, there's not always that nice, neat box that a patient fits into.
So how many people are we talking about who are going into this sort of little bit of a netherworld?
At the moment, the exact numbers are unknown. That is one of the follow-ups that we would like to work on, is to try to look at the data and get a better sense of, how many individuals there are out there, and to what extent it is happening. And that was part of the goal of the paper, was to raise awareness of the situation so that we can bring all stakeholders together to work on the issue.
So specifically, what do you want people to take away from the white paper?
That, this is a problem that is occurring, that it is a much bigger issue than just, hospitals or one stakeholder can involve. There needs to be a group effort across the board to identify where there are regulatory barriers, where there may be legal barriers, where there are gaps in services that are available, gaps in workforce, to provide those services, and really have everyone put their heads together to work out solutions so that patients don't get stuck in the hospitals for long periods of time.
Vic, how much of this is silo thinking? How much of it is dollars and cents? How much of it is infrastructure?
It's a combination of all of it. Unfortunately, I think the way the healthcare system has developed, it is very siloed in its thinking and its criteria for certain places. You either, fit neatly within this particular agency, or you fit within this other agency. And when it crosses over and the patient fits in with both, it becomes an issue. It's also, the infrastructure and figuring out how to fund and provide all of the services.
Hospitals are under great pressure not to readmit. So how much does this add to readmission numbers?
It certainly doesn't help, because if, the discharge placement ends up not working out and it ends up being truly an imperfect answer, we do see some patients that come back and, are readmitted, and then it may start the cycle all over again.
The white paper lays out all the reasons, as you say in your release, that the current state is untenable. So something has to happen. In your blueprint from the white paper, what would be the first 2 or 3 steps?
I think the first 2 or 3 steps are gathering the data to really get a sense of the scope of the problem, and then bringing in all of the different stakeholders. We know that there are conversations going on throughout the state, and we know there are different pockets of cross agencies working together. It's a matter of, I think everyone is still working within their individual areas and their silos. And it's now, let's all come together and focus on this together as one big group.
And this is not only for seniors. Many times this is someone who is younger who has substance abuse issues, along with other health
That's
problems.
correct. It's not just with elderly patients. You know, a number of our hospitals have seen it with adolescents who may have an intellectual and or developmental disability. We see it for individuals who have a psychiatric issue. Oftentimes it's difficult medical conditions as well. So it does span across individuals and patients.
And before I let you go, for families who are stuck in this, what would you tell them to do when they really feel, I'm sorry, but the discharge is not appropriate?
You know, it is very difficult for the families. And I would say, you know, keep advocating for what you do think is best, you know, for the patients. A lot of our hospitals have really worked on forming internal teams that take into considerations the family's thoughts, their ability to care for the patients, and you know, what options there are.
Vic Aufiero with HANYS, thanks so very much. A lot of work ahead. I'm sure you'll be listening for all of the input, because the bottom line is the safety and the health of our friends and loved ones.
Absolutely. Thank you so much for having me.
Thanks. And thank you for spending time with us today for Health Beat. We'll see you next time.